This is a software demonstration for the Spine 3D LiDAR machine by Sensor Medica. This particular patient is a teenage girl who came in with suspected scoliosis. We did our normal examination, some specialist scoliosis testing, and that included a LiDAR scan, which did predict the presence of a curvature. We then took x rays to confirm that there was an idiopathic adolescent scoliosis, and the cob angles predicted by the Spine 3D machine pretty much to the half of a degree matched the actual cob angles on the X-ray. From the photo to the slices and concavity, one of the benefits when we do have an X-ray of a patient is we can actually upload their X-ray, and you can see the accurate correlation between the 3D predictions and the rotational component, which is obviously something that an X-ray can't give us because of its two-dimensional values on a three-dimensional body. We can add various different settings in, which are off on default, so we can add some or all of these in. I tend to find if you add them all in, it's quite overwhelming for the patient, so we tend to add one or two at a time. You can remove or add the spinal image, hide this, hide the charts, so that you can actually talk about things one at a time. You can also hide sections of the spine if the data becomes overwhelming. However, I tend to prefer to show most of my results on the two-dimensional images because it's easier for a patient to understand this. This here we're looking at the normative values and the center of posture, which we can push here. And that will actually show the center of gravity through the body. And we can change this to a coronal view and a transverse view at the same time, which is great to show where the rotation is. And then the top image is almost a cross section of what's actually happening at those levels, showing the rotation out and away from the heart, pushing those right hand ribs back, which is creating the rib hump and a right scapular winging. Here. Now you can see how much it correlates with the X-ray, and on this view, the two images in the middle are actually showing the data, the cob angle data. The red line is the spinous process line, so that's where the patient will actually be able to feel and palpate the spine. But the vertebral bodies on this image are actually overlaid where the vertebral body will be based on an algorithm and normal vertebral length with rotation. So you can see peak rotation here, curves at the apex of the curvature, which is interesting for us to know, particularly when we're looking at bracing. That can change over time, so we can repeat these scans multiple levels. It's really quite handy to have their center of gravity, which is you would need a posture plate, a gate platform attached to the Spine 3D whilst doing this. You can see a lot of the normative values are outside of the normal range, but their center of gravity, that red line, is running behind them. So there's always going to be load in the facets, and we have to be careful that there isn't a thoracolumbar collapse and potentially an anteropelvic tilt, which would really compress the L5S1 segment. On her feet, you can see her center of gravity is just off to the right, 44 and 56%, or you can look at the kilograms left to right, which is sometimes for patients a better understanding how many bags of sugar heavier they are on one side. You can see there's very little pressure going through the toes on both feet, none at all really on the outer toes. And the center of gravity is weighted significantly in their heels with hardly anything through their midfoot. Now, you can actually remove all of the different sections when creating a report. It can be overwhelming sometimes, and add and subtract anything that you think is relevant before generating reports. And you can see here it will then only show the areas that you've requested.